Hello, good evening. The terrible effects of the Covid pandemic can still be seen and felt in our communities. One area where this is particularly stark is the investigation into how some patients acquire the disease in hospital. New figures uncovered by this programme show over 20,000 cases are still to be investigated. Welsh Government admit it could take 2 years for all families to get answers, but extra staff have been brought in to deal with the cases. Here's our reporter Hamish Auskerry to explain more.
One day, these fields in Cymru will be home to a memorial woodland. Thousands of growing trees will each represent a life cut short by Covid-19 in Wales. In March this year, the First Minister helped plant the first sapling here, but the rest won't go in the ground until this winter. It's hoped that eventually this stunning location will help people find comfort and closure in the loss they endured. But for thousands of people, like Tina Evans from Carmarthenshire, that's not possible yet.
He was just, very quiet, private.
Tina lost her dad Michael in November 2020.
Active though and outdoorsy.
Yes, he was. I mean, when he was working, he was a fit, strong man, I guess.
She last saw him through the window of the hospital 2 days before he died.
He was confused. We didn't really have a meaningful conversation. And to be honest though, I never thought that would be the last time that I'd see him alive. But it was.
Tina first asked questions about her dad's care in June 2021. Every 3 months she receives a letter from the health board telling her that the investigation hasn't yet been completed.
You've obviously been going through the process of trying to get answers. Tell me how that's been going.
There seems to be difficulties in getting answers to the questions I've put to them. There are some gaps in the notes that I wanted some clarity on. It's nearly 2 years and I'm none the wiser, to be honest with you.
In a statement, Hywel Dda said they're in the process of providing a response to the concerns Tina has raised. In it, they said, along with other health boards, we are following the review process for healthcare-acquired Covid-19. While this is taking longer than we would like, the Health Board is committed to following the governance arrangements agreed with Welsh Government. We understand this process is difficult and we aim to make significant progress in engaging with families in the coming months, particularly those whose family member has died. It'll be a few years before this looks and feels like a memorial woodland. But some of those families who experienced a bereavement during the pandemic due to Covid-19 may also have to wait a while before they get some of the answers that they're looking for. The Welsh Government says there are around 20,500 incidents of probable or definite healthcare-acquired Covid-19 infections that require investigation. But so far, just over 2,300 have been completed.
It looks as though it may take another 3 or more years for some people who experience a bereavement to get the answers they want from investigations. Is it going to take that long for people?
I hope it won't take 3 or 4 years. I think it could take best part of 2 years. I mean, this is a big task and the NHS has had to appoint some extra staff to be able to undertake these investigations. We've had to put in place some mechanisms in the NHS to ensure this is all done consistently and properly to the right standard. And that has all taken some time. Having said that, they've already completed thousands of investigations. And so actually they are making good progress and actually the pace is picking up.
Tina says she still experiences flashbacks to the last traumatic days of her dad's life, knowing he was ill in hospital but unable to visit him or even say goodbye.
Will it bring you perhaps a sense of closure if you fill in those gaps?
Yes, definitely, because I have a sense of guilt that I didn't do enough for my father. It hasn't been a normal way of grieving. There wasn't any normalcy to it. And I know lots of people have been in the same situation, but When you are in that situation, it's really quite difficult to get over.
The creation of the COVID memorial woodland here has to wait for the seasons to change to ensure the trees planted here have the best chance of survival. But with the virus still circulating in our communities, there will, sadly, be new names to be remembered here. And for the families of those who catch Covid-19 in a healthcare environment, they too will add their questions to the backlog of investigations already waiting to start.
And Hamish is here with me now. Hamish, some really stark figures in your report.
Yes, they are. And look, we know the health service is under pressure. We know the pressures are only mounting for them. But that's why the Welsh Government provided this extra £4.5 million to help health boards to complete this work. Now, what we can see is that Cardiff and Vale Health Board and Betsy Cadwallader have made some progress, but they still have the majority of investigations still to be completed. But the latest data shows that 2 health boards, that's Aneurin Bevan and Swansea Bay, had completed 0 investigations by last month. And for some context, those 2 health boards alone have another 5,000 investigations yet to start.
And the legacy of COVID still very real.
Yes, you could feel that sense from Tina, couldn't you, in my report, the feelings that she still has over that period, and people like her across the country. Now, look, beyond the very personal importance to her and others for these investigations, there's also a very important general reason for doing them. That's to help the health board to learn lessons from the pandemic, hopefully to prepare better, perhaps, for a future wave of COVID or a future different kind of pandemic. So that's perhaps even more important in Wales because the First Minister has repeatedly refused to have a Wales-specific COVID inquiry, relying on the UK-wide one, which is just getting going. The Welsh Government, though, they say there will be an interim learning report about the work that's been going on in these healthcare-acquired COVID-19 investigations. That will publish towards the end of March next year. But until then, families like Tina are still having to wait for answers.
OK, Hamish, thank you very much indeed.